Toward the end of medical school, it's a little bit of a transition where it goes from the foundational knowledge that you learn in the classroom and you're just on the verge of starting your job, starting your residency.
The Michigan philosophy is that every Michigan medical student is going to graduate as a leader and one of the best in the country. One of the ways that they do that is by really throwing our medical students into the clinical realm and really getting their hands dirty with clinical medicine and learning about the art of medicine they're actually practicing.
From day one, it's about how to make you a skilled, practical physician, and it all kind of leads up to these residency prep courses.
So residency prep course is this intensive course which is intended to kind of give you the skills and building blocks to become a very efficient and hardworking resident.
I love these residency prep courses because the students are so engaged and they want this.
One of the biggest transitions is going from med student to resident. Not only is there a big jump in terms of responsibilities and what you're expected to know and to be able to do, but there's also a big lapse in time.
I haven't been in the OR for quite some time, so it's great to be able to get to go back, practice those skills, and make sure that I'm fresh and ready for residency.
The residency prep course really helps you brush off the cobwebs from that knowledge that you once knew, and then also learn how to put it into use.
Yay! Yeah, worked. I intubated him successfully. So I've done it my M1 year, but this is the first time since then.
The residency prep courses that we offer at Michigan will vary between 4 to 8 weeks, depending on which specialty you're ultimately going to go into, whether that's OBGYN or general surgery, emergency medicine, internal medicine, etc.
So this entire floor is actually full of patient rooms where you have full body mannequins, so you can practice delivering babies, you can practice a code, which is when you have to do things like CPR and give medications to resuscitate a patient.
I think this is super useful as a future anesthesiologist to do this ahead of time on mannequins.
The instructor can throw whatever scenario they want at you, and it might be that their heart goes into an abnormal beat or that they can't breathe. It might be one of those situations where you have to act quickly. And it's nice to know that the first time you have to lead a team as a resident for an emergency situation, it isn't the first time you've ever done it.
Some of us haven't done clinical rotations for a while, and we're a bit nervous about starting residency as new interns, and so getting more practice with sort of more practical, high-yield skills was really very, very, very helpful.
I know on my first day of residency I'll still be nervous, I'll certainly still make mistakes, and I'll have a lot to learn, but this is just going to smoothen that transition a little bit more for my benefit, for the benefit of my future patients, and so I'm really excited to have this opportunity.